Leukemia. Leukemia is the most common childhood cancer, accounting for around 28% of all cancers diagnosed in children under the age of 15 in the United States. Leukemia essentially affects the body's blood-forming tissues, such as the bone marrow and the lymphatic system. It begins when specific blood cells acquire mutations in their DNA, causing them to grow and divide uncontrollably. There are two main types of this cancer: acute lymphoblastic leukemia, ALL, which is the most common form of childhood leukemia, making up about 75% of childhood leukemia cases. It typically affects children between the ages of 2 and 8 years old, where the body makes a huge amount of immature types of white blood cells called lymphoblasts at a rate the body cannot handle. Acute myeloid leukemia, AML. This accounts for about 20% of childhood leukemia cases, which creates immature myeloid cells, another type of white blood cell. In children with leukemia, the abnormal cells accumulate in the bone marrow, crowding out average blood cell production. This can lead to symptoms such as fatigue, easy bruising or bleeding, frequent infections, fever, and bone or joint pain, which are usually quite severe to the point where, even at such a young age, they need painkillers like morphine just to dull the pain by a little. Treatment for childhood leukemia typically involves extremely intensive chemotherapy to the point where a majority of them all lose their hair. Sometimes it can be combined with radiation therapy or stem cell transplantation. The goal is to induce remission by destroying the leukemia cells and allowing average blood cell production to resume. Early diagnosis and treatment are really important for improving outcomes in children with leukemia. With modern treatments and supportive care, the overall 5-year survival rate for childhood acute lymphoblastic leukemia is now around 90%, and for childhood acute myeloid leukemia is around 65%.